All right, good morning, everyone. Welcome to today's civic presentation. This is our next in a series of Parkinson's disease presentations. And today we are joined by Dr. Joshua Weaver. He is an assistant professor of neurology at Weill Cornell Medical College and assistant attending neurologist at New York Presbyterian Hospital. He currently serves as the co-director for the Weill Cornell Medicine Center for Comprehensive Spine Care, and he has a particular interest in treating spine disorders and peripheral neuropathy, and he uses an integrative and holistic approach in his care of patients. So for today, Dr. Weaver will be discussing the integration of complementary and alternative medicine in the treatment of Parkinson's disease, and he'll go into a bit more detail to describe what that entails. And then we've also left some time at the end for any questions. And just a reminder that I'll be administering a poll at the end of the presentation. It's completely optional, but would be helpful if you fill it out just so we can get a better sense of our audience. And in addition, we'll also be translating the presentation into Spanish, and we'll be posting the recording onto our YouTube channel, which I will also link into the chat right here. But in the meantime, I'll pass over the floor to Dr. Joshua Weaver. So feel free to take it away whenever you're ready.
All right, thank you so much for that introduction, and thank you for having me here. So today, as Allegra mentioned, I'm going to be talking about what we call integrative medicine, which is really bringing together complementary and alternative medicine to conventional medicine and how we may apply that to Parkinson's disease. So I don't have any relevant financial disclosures. So just a brief discussion of what is integrative medicine. So a lot of people may be familiar with what we call conventional medicine. This is, when you go to your doctor and they have medications or other interventional treatments to treat a variety of symptoms that you have. What a lot of us in medicine are starting to do more and more is really include a lot of other lifestyle factors in trying to keep people healthy. So talking about diet and exercise, spiritual health, environmental concerns, where you live in your community and on a broader scale. And then there's this complementary and alternative medicine, which really encompasses a lot of mostly non-Western medicine. But it can range for really anything involving mind-body practices, supplements, real whole host of other treatment options. And I'm going to go through that in a lot more detail as I go through the talk. So what integrative medicine tries to do is it tries to kind of be in the middle of this diagram here. It brings us together the usual approaches that Western medicine has, which are really important and work really well, but it adds in other types of treatment options, which a lot of people do already, or they might feel more comfortable with. So just as a little way of background, I had a very conventional medicine training, which pretty much all doctors do. I had my typical medical school training and residency training go into neurology. And although I practiced more doing spine care and peripheral nerve issues, I do work closely with other subspecialties, particularly regarding integrative medicine. And so that's why today's talk is going to be focused around Parkinson's disease. I did a fellowship that I just completed last year in integrative health and medicine with this Academy of Integrative Health and Medicine. And it was a 2-year course where I just learned a lot about all of those other complementary treatment options. So just really quick about Parkinson's disease, and this is a very wordy slide, I apologize for that, but just to go over, it's a progressive disorder. I'm not sure, I assume most people coming onto this understand a little bit about it. But basically, it involves a neurodegenerative condition where you have loss of neurons and a reduction in dopamine in the brain. It is not very uncommon. It's about 100 out of every 100,000 people, generally over the age of 40. Not that common to occur under the age of 40. The average age of diagnosis is actually much older, around 70. The main features that we see are really those first 3 out of those 4. So tremor is really often the most noticeable and the first sign that you see. This is what's known as a resting tremor. So when the arms are at rest, and it's usually asymmetric. So one side it'll occur versus the other, you'll start to get a slow kind of what's called a pill rolling tremor with the thumb and the finger. And this can progress slowly over time and involve other limbs or even the neck. We often will see what's called bradykinesia, which is just slow movements. So things sometimes are just a little bit slower, and that can get worse over time. Rigidity is also something that we see in Parkinson's disease, where the muscles become stiffer. And then later in the disease, we often see postural instability. And that's where people have issues with balance and difficulty with walking. There are, however, a lot of other features that we see, and these are often the focus of other types of treatments. So first of all, sometimes people can have decreased blinking of the eyes, trouble swallowing, something called masked facies, where it's just reduced facial expressions. Sometimes it kind of looks like people are staring with Parkinson's disease. Sometimes the volume of someone's voice can be lower. There can be visual issues. Handwriting can get smaller. People often notice this. The posture, as you can see here in this picture, is often kind of stooped when people walk. You can get muscle cramps, muscle jerks. You can have spinal issues. That's often where it comes into my domain. And then in terms of walking, the biggest sign that people see when they walk is a shuffling kind of gait, where they're not lifting up their feet as much as they should be. There are other parts of the gait that we see. Sometimes it's hard for people to stop when they're walking, and so they just keep going and they can't stop and they'll fall. Sometimes it's the other way. It's hard to start, so they'll stand up from a chair and they can't get the motion going, so they get kind of stuck. And so there are lots of ways to try to work on these features. But I will point out that over the last 10 to 20 years, there has been a focus on non-motor features. All of those things are muscle-related issues. But there's a lot that we see that's not really muscular at all. We see slowed thinking, so it's just people are a little bit slower to come up with responses. We see difficulty with certain cognitive domains. Sometimes they can have memory issues. Often later in the course of the illness, you can have issues with hallucinations or delusions. Mood disorders are actually really common, so getting depression or anxiety or having a lack of desire to do things. Sleep disturbances are really common, and we do see that quite a bit. So that's you can get daytime sleepiness, a difficulty sleeping at night, restless leg syndrome, acting out your dreams. It's called REM behavioral sleep disorder. Fatigue, which is kind of vague, but really common in Parkinson's, can occur. Autonomic dysfunction. So there's a lot of things here. There's a specific group of nerves in the body that control a lot of our organ function. And so you'll see people with lightheadedness or constipation or urinary problems. This can all happen with Parkinson's as well. And the list goes on and on. There's a lot of things that can occur in Parkinson's. And often people have a lot of these going on. May not be the primary feature, but they're really important. Now, typical treatments, this is our conventional medicine that we do. There's a lot of different medications. I'm not going to go into too much detail about this because this is what your doctors already really know. There's a lot of good data for all of these medications. The ones that often get started on patients are these MAO-B inhibitors, which basically help increase levels of dopamine. There's dopamine agonists, which are things that will act as if they were dopamine, so they can give that to people. And all of these things just help raise those dopamine levels, and they can be really good for early Parkinson's to really get rid of, the tremor, help the walking a little bit, help the rigidity a little bit. Levodopa is often combined with carbidopa. This is something that we often use in older patients to start, although many people with Parkinson's at some point often will get tried on this. While the other ones are good for earlier or milder symptoms, this is often good for moderate or severe disease, so later in the course. Sometimes if you're on this medication for a long time, you can get fluctuations in your motor ability, And you can also get abnormal movements that can occur called dyskinesias. So this is kind of like the typical treatments that we do. We also often include physical therapy, is very often included to work on balance and to work on trying to increase the movements that you make. Because again, what happens in Parkinson's is you get smaller movements with everything, voice, arms, legs. And so part of physical therapy works on building strength and balance. Part of physical therapy works on really increasing those movements. Now, in terms of complementary alternative approaches, these are some things that are, not your typical just pharmaceutical medications. It turns out that there was a survey done in, multiple surveys have been done over the time, showing that anywhere from 40 to 85% of people with Parkinson's do use complementary and alternative health medicine treatments. There was a recent survey done in 2019 that I like to show for a couple of reasons, and it really dives into what treatments people often do. And this is not always at the direction of their physician. This is just what they're using. About 50% of people have tried at least one of these treatments. Some people have tried even up to 8. Most people have tried 2 to 3 of these types of treatments. And there are many others that were not even on the list where people have tried. But the common ones that people do, massage, yoga, Tai Chi, meditation, acupuncture, you can see a lot of people with Parkinson's disease will venture out from their typical treatments and try other things to see if it will help. What I liked about this survey was that they also asked, how effective are these treatments? So this is not really looking at scientific outcomes or anything like that. It's asking people, when you do massage, when you do Tai Chi, do you think it's effective for you? And it's a really large number of people who do these things and really think it makes a difference. And honestly, that's the most important thing. It's not whether we think it's going to help or not, it's if it's actually helping you. So, you'll see massage, yoga, meditation, visualization, acupressure, all of these things, people really feel, a good 3/4 of people at least really feel that it helps. So that's an important thing to know, which is part of the reason why I got into this, which was to really understand these treatment options better and see what the data is behind them. So there are people, remember there was about 50 to 60% of people who were using complementary and alternative medicine, but they also asked the people in the survey, if you weren't doing these treatments, why not? So it turns out the largest chunk of these people just didn't know about them, right? They didn't know these things were even out there or available. Their doctor hadn't suggested it to them. They didn't know where to look for them. They didn't know where in the community they could find these things. Some people just felt like they knew about these things, but didn't think it would really work. Some people felt they just didn't need it, that the medications were working fine. And some people had barriers to getting these treatments, namely cost. A lot of times insurance won't cover these types of treatments. And so it could be very prohibitive for people to do that. So in terms of integrative treatments, how do we bring all these things together? So this is part of what I do when I see patients. Now, again, I don't primarily see Parkinson's disease patients, but the idea when I see a patient is not just to focus on symptoms. So I don't just focus on, okay, so you have tremors. Oh, I have a good pill for that, right? Focus on, well, what does that mean for you when you have tremors? Does it cause problems for you? What are you trying to get out of this visit? What do you want in general for your life? We talk about, socially, what does it mean for you? Emotionally, are you having mood problems? Spiritually, are you having issues with faith? And is that a problem? Physically, is it hard for you to get around? Is it hard for you to get up and down stairs? What are the things that are really limiting you? And so we try to kind of think of things in terms of, what are your goals? Where can we get you to where you want to be, right? And so that's what we want to do. What do the symptoms actually mean to you? Not necessarily just what are your symptoms, okay? And then when we want to think about how do we provide personalized care, it's not just here's your pill, although that's a big part of it, right? Getting a medication is usually part of the treatment plan, but there could be a lot more based on your goals in terms of what we can do to help you get there. So we think about lifestyle, right? We think about nutrition, we think about exercise, we think about self-care, we think about family and friends, we think about your relationship to nature and your community. So we think about all these things because that is a really important part of health goals in general. We think about the biochemical side of things. So that's where your prescriptions come in, but it's also where you might consider supplements or herbal medications, right? These are really important. We think about what we call biofield treatments. These are sort of like energy treatments. They're hard to quantify, they're hard to do research on, although there is research on these things. We think about acupuncture, Tai Chi, meditation, prayer. These things are actually really important, and a lot of doctors don't talk about them, but they probably should. And then finally, we think about biomechanical. This is where your physical therapy or your massage can come in. So more physical, hands-on sort of treatments. So we kind of talk about all these things. We figure out what makes sense for you personally, and we try to put it all together. In terms of, as a doctor, how do I recommend certain things, right? So I try to look through the data, and I've done this for Parkinson's disease, in terms of, are these treatments effective? So is there data to support it, yes or no? And are these treatments safe, yes or no, right? If there's enough data, so this is randomized controlled trials, right? If there's enough really good, strong data to say, yeah, it's effective and it's safe, well, then that's something that we can recommend, right? If there's not a lot of great data, but these treatments appear to be safe based on what's out there, that's something I may not recommend to people that they should do. But if they want to do them or they're already doing them, that's something we can tolerate and we'll keep an eye on it. If it's effective, but not necessarily safe in the sense that there might be side effects or there might be dangers to it, well, we monitor that. You know, it's not that you can't take it, but we have to be careful. And this is actually where most of the medications live. You know, we give you these medications, but they can cause side effects, as I'm sure many people are aware here. If you've ever taken a pill and had a bad side effect to it, you know, they're not always 100% safe. And so that's something that we would just monitor closely. And then if they're not effective and they're clearly not safe, we would actively advise against that. So this is kind of the framework of how I go through the data and get a sense of, you know, what's reasonable to do. So having said all that, let's actually look at some of the data, see what's actually good out there, okay? So in terms of biochemical, right? These are the medications that I brought up, which for sure have a lot of good data. So we know that they're effective, but they may cause side effects. And that was mentioned a little earlier. So those are things we would definitely recommend, but we would monitor, okay? But there's a lot of things out there about vitamins, minerals, enzymes, fatty acids, herbal medications, right? And there's a lot of things that are touted online. If you look online, you'll see, oh, take this supplement and pay me, you know, $50 a bottle for it, and it totally works for your Parkinson's. Well, does it? You know, that's the question. A lot of these vitamins and minerals are touted to have sort of anti-inflammatory properties. And part of that is because of what's going on in the brain. We think that there's an inflammatory component to Parkinson's that involves mitochondrial dysfunction. This is called reactive oxidation species. It's just chemicals in the brain that build up that can cause inflammation. So you get neuroinflammation, stress on a cellular level in the brain, and it can then create these abnormal proteins that can build up and cause cells to die, particularly those that cause dopamine to be released. So there's a lot that's been looked at. And I summarize, you know, the big ones that actually have some data behind them, but they often don't necessarily work based on the data. So it's important to know. So coenzyme Q10 is an antioxidant, and that like an anti-inflammatory type of medication. And that's been looked at quite a bit with Parkinson's. In animal studies, it does seem to slow down the loss of dopamine. Okay, so there's some theory that it could help. However, in human studies, there's really mixed results, okay? So there are a couple of small studies that people actually got a little bit better with their Parkinson's, but there were several studies that they really did not, okay? So you can't say 100%, there's not enough strong data to say that this will definitely work, but it appears to be very safe, and this is something we could consider, or at least tolerate the use of. Just to keep in mind, by the way, that coenzyme Q10 may interact with certain blood thinners like warfarin. So supplements, even when they're natural, they're not always safe. So you need to be really careful about that. Vitamin E has been looked at quite a bit as well. It's actually 8 different molecules, but they're antioxidants. And this actually really showed no improvement in Parkinson's disease. This has been looked at in several studies. And in fact, in men, high doses of vitamin E led to an increased risk of prostate cancer. And so this is something that you do want to be careful about. And that's another example where, you know, these things are not always safe and you want to ask your doctor before starting these things. Omega-3 fatty acids, there's one promising but small study that it showed improvement in Parkinson's. So this is kind of interesting to see. It's not enough to recommend, and they are looking into this. There are other studies that are out there that are being conducted. And so this is something that we'll be curious to see in the future if this is helpful. Relatively safe, take omega-3 fatty acids. If you have a diet high in fish or flaxseed, you're going to get some of these omega-3 fatty acids. So, you know, dietary wise, you can improve on this, but there are supplements out there for that. Again, not enough to recommend, but promising. Creatine has been looked at, no benefit. There's been multiple small studies. It does appear to be pretty safe, although high doses can definitely cause GI side effects. So it doesn't appear to really help. And if anything, it may just cause you to have some GI upset, some stomach upset. So that's something not really necessarily the best thing to do. And then cannabis or marijuana. This is a big one. A lot of people with Parkinson's are looking into this. New York State actually allows people with Parkinson's to qualify for medical marijuana. The problem is there's really no big studies that have looked at medical marijuana. There are a couple of small studies that have looked at synthetic marijuana. This is, you know, things that look like THC or CBD, which are those compounds that are in marijuana. So there are these synthetic marijuanas that are out there that have shown benefit in Parkinson's. And there are some small studies looking at, medical marijuana, but nothing big yet. It appears to be generally safe in, you know, marijuana in general. However, we don't have enough long-term data to really say one way or the other. Okay, so this is again something we might not necessarily recommend, but this is something that we could tolerate. And if your doctor thinks you might be a good candidate for it, this is something where you might consider trying it, you know, at the advice of your doctor. So in terms of coming back to this, we would tolerate maybe coenzyme Q10, omega-3 fatty acids, medications, and I would put cannabis under here. We would want to kind of monitor closely because the potential side effects is pretty high. And then certain things we would advise against would be, particularly in men, I wouldn't do high doses of vitamin E, and high doses of creatine just seem to cause problems. So that's the biochemical side of things. Now we're going to look at some of the lifestyle kinds of things. You know, people, I don't know how many people here have had their doctors tell them you should have a healthy diet or you should get regular exercise. And that's all well and good. We know that that should be done, but we don't really know, what does that mean? What diet should we do? What exercise should we do, right? So there's a big push right now to look at Parkinson's and look at the relationship between your gut, the microbiome, all the bacteria, the good bacteria that are living in your gut, and that relationship with your brain, okay? And there does seem to be some crosstalk between your gut and your brain, particularly regarding Parkinson's. However, this kind of data is still very, very new, and we're still trying to figure this out. So people have looked at things like a Mediterranean diet or anti-inflammatory diet. There's actually decent data out there to suggest that these types of diets will reduce your risk of developing Parkinson's, okay? Not that it's going to make that risk zero, but it may reduce your risk of developing it. But there's not a lot of data to suggest that once you have Parkinson's, that this will actually change the course of your disease. Having said that, a Mediterranean or an anti-inflammatory diet or a plant-based diet, when done appropriately, these diets can be excellent for so many other health reasons, right? There's a lot of data on cardiovascular health and risk of stroke, reducing that risk. So there's a lot of things out there where you might recommend these diets on the basis of that, but not necessarily for Parkinson's alone. In terms of exercise, what do we do? Aerobic, endurance, strength training, balance, flexibility, all of the above? Do we do any of these other things that are kind of part of physical exercise? Well, there's actually some data to show that that's been looked at a little bit in terms of breaking it down. I mentioned the microbiome. Probiotics have been looked at in Parkinson's disease. It does seem to help with constipation. So if constipation is an issue for you and you have Parkinson's, probiotics are certainly reasonable to start because they actually can help with constipation, but they don't seem to do anything for Parkinson's disease itself. Same thing with Mediterranean diet. That's what I mentioned. It may reduce your risk of developing it, but doesn't seem to, we don't have any data to suggest that it does things to the course of the disease. Now, in terms of exercise, it's the same kind of thing. There's a lot of data where exercise can reduce your risk of Parkinson's. And there are some data, very small studies, that show that exercise done early on in Parkinson's disease can reduce cognitive decline that happens much later in the disease. So in general, exercise is a good thing, but we don't have it nailed down in terms of, exactly what kind would you want to do. Interestingly, dance has been looked at quite a bit, and there are a lot of studies on dance. There was a big review of a lot of studies in 2017 that was done that showed music and dancing actually helped in terms of synchronizing movements. And that's really the big issue with Parkinson's. It's hard to coordinate movement. And so this was actually really great. It showed that music and dancing in general could actually help with motor performance in Parkinson's. Particularly, there's a group in Argentina that has looked at tango, and they did multiple studies. Keep in mind, these were all done by the same group. So it's a little hard to say for sure if that's accurate, but it really seemed to improve motor and balance symptoms. So getting into some kind of dancing, maybe even tango, if you have access to that, that's pretty reasonable. That might actually help. There are many, many, many other studies that showed dancing was beneficial, but they're all really small. They use different kinds of dancing. So I think the idea here is just get moving, and it does seem to be helpful. So tango is great. In general, exercise and maybe Mediterranean diet is good to recommend, though not necessarily for Parkinson's, maybe for other reasons. So I think that's okay to put in the recommendation. Now, Biofield is the next thing. This is like sort of the energy kind of therapies that are out there. So here we've got, yoga has been looked at, and there's a few early randomized controlled trials that just looked at small numbers of patients that seem to show improvement in motor and gait. And so this is actually kind of nice. Yoga in general is a good thing to do if you're able to do it. They have modified yoga classes for people who have physical limitations, but this is a nice thing. Not enough data to really say that it does anything, but a little bit of promise that it may help. Tai Chi, interestingly, many studies. And although there are some mixed results, there's actually been a lot of meta reviews that kind of pile all these together. And over the last 10 years, there have been a lot of reviews of all the studies that are out there, good or bad. And overall, it seems to be beneficial. The net, outcomes seem to be good for Tai Chi. So this is something that can really help, particularly for balance and walking. Meditation and mindfulness, there's a few small studies. These are really hard to quantify because they often use different styles of meditation or mindfulness. There may be some improvement in functioning, but hard to say. And then same thing with acupuncture. Acupuncture is interesting. It may help with certain symptoms. There are a lot of studies that have looked at it, but they're often very low quality studies. So it's really hard to recommend because we don't have any really good high quality studies. And interestingly, many of the studies have a placebo. So they have people going in and you're either getting the acupuncture or you're getting a little pressure that doesn't actually pierce the skin. And people who get the placebo actually do just as well as the people who got the treatment. So it's hard to know what's actually working there. And there are some data to suggest that it's a culturally relevant thing. So when it's done in countries in which acupuncture is more accepted, there's actually better improvement. So hard to know what's going on with acupuncture, but again, generally a low risk treatment, and that's something that we may consider doing. So I added Tai Chi as something that I think has the most data behind it. So that's something to look into. A lot of these other ones, yoga, meditation, acupuncture, These are things that we certainly would tolerate. There's very low risk. They're very, very safe in general to do. And so, reasonable to put them on. And then the last one is biomechanical, right? So this is your physical therapies, massage, that sort of thing. So looking at all these different types of treatments that are out there, again, it's a little hard to lump all of them together because they all do different modalities of treatment. So for instance, resistance training probably has a more data than other types of training that's out there. We do see improved strength and mobility, but resistance training seems to help everybody, and there's not a lot of studies that look specifically for people with Parkinson's. So hard to say specifically do this. There are studies in Parkinson's disease patients who have used gait training with certain cues, so visual or auditory, and they can do certain treadmill exercises that use these cues, and that seems to help gait. There are a few studies that have looked at these, what's called Nordic walking. You use these ski poles here on the bottom right. And it's kind of interesting because we don't typically do this, but those few studies actually did seem to help with people with Parkinson's. It helped with gait and balance. There are certain types of physical therapy that just focus on balance, and that does reduce your risk of falls. And massage therapy has been looked at too. Which didn't really help so much with the rigidity, but people did show reduced stress. And stress can be a huge part of physical therapy, a part of Parkinson's disease. And I think stress often makes symptoms worse subjectively. So reducing stress is always a good thing to do. So in terms of where do we put this in our framework for therapies, I don't think there's enough to say exactly what kind, but I think in general, it's very clear that physical therapy, occupational therapy is reasonable to put in here. I put it kind of other types of resistance training or massage, we would put it in as tolerate. There's just not a lot of data for specific ones. I should say one of the big ones for big types of PT and OT is called where they use these large movements, and I'm blanking on the name right now, but there are these, I think it's called like LVST or something, these large volume movements that you make, and that has a decent amount of data behind it in terms of this type of physical therapy that really works on trying to do big movements, because part of the issue with Parkinson's is you do these little movements and you have these, your gait is very shuffling and small steps, and it really works on being mindful and making your body take bigger movements than you think it needs. And they also have that for the voice as well. When people have a quieter voice, they work on projecting that voice. And that actually has a fair amount of data behind it. So that would be reasonable to put in there. So this is the bottom line in terms of, if someone were to come to me and say, I'm having these symptoms and here's what it means to me and here's where I want to be, here's what I want to work on, this is kind of the format that I would follow. And I would say, all right, well, there's some things we can definitely recommend, and I would start there. If there's particular interest in some of these other things that we would tolerate, I would say that's okay to do. Here's a couple of things to keep in mind here, even though they're low risk, they're not no risk. And it's important to know that. And so we would talk about that, and we would come up with a good treatment plan, and sort of follow over time. And that's kind of how I think we use integrative medicine, and we just bring this all together to really create something that's a specific treatment regimen for you as an individual. And that's kind of where I think this model is a little different than conventional medicine, where everyone just kind of gets the same medications and that's it, So that is basically it. It's a shorter than usual talk, but I did want to just point in here. This is a great foundation. There's support groups for Parkinson's disease. We have a great group here at Cornell. My colleagues who work there are fantastic. This is the number. In case anyone is interested in reaching out, they actually do follow this model and think about it from an integrative perspective. And so I think they're really wonderful to see. And so, yeah, I'd be happy to take any questions. I see some people are writing in the chat, which is great. Or you can feel free to speak, I think. And Allegra, I think you had a couple of things you wanted to mention.
Yeah, thank you so much for the great presentation and going into detail about all the different therapies and strategies. So I think that was great. And if anyone has any questions, feel free to either ask aloud, or if you'd rather just ask your question in the chat and then I can read it out loud, that would also work. And for the meantime, I'm just going to post the link to our YouTube channel if anyone wants to watch the Spanish presentation or send the presentation to anybody. I don't see any questions in the chat as of yet. I see Elliot mentioned turmeric. I'm not sure if that's a type of
Something to
treatment
talk
or
about.
any question
No,
about
that's
that.
fine. Turmeric actually, and also like a different form of it called curcumin, has a lot of data as an anti-inflammatory sort of molecule. It actually works in a similar way that ibuprofen and NSAIDs, non-steroidal anti-inflammatories, work. So there is some, there are certain disorders where you will look at turmeric. Parkinson's, to my knowledge, doesn't have a lot of data specifically for Parkinson's for turmeric. As an anti-inflammatory agent, it can work on reducing pain. There's some data for that. And I guess in theory, just as an anti-inflammatory agent to have on board in case there's an inflammatory component to Parkinson's, it's not unreasonable, but we really don't have any data to say for sure. It's generally very safe, even at higher doses. And there's a lot of small studies on turmeric to say that. So that would be probably under the tolerate list. Definitely not enough data to say you should use it or that it's going to make a difference in Parkinson's disease, but not unreasonable to have on board. And then I see Donna says here, is there data to suggest a gluten-free and or dairy-free diet has an impact on the gut microbiome and brain connection with Parkinson's? So people are actively looking into that now. I would say there's probably an association between gluten-free, potentially dairy-free diets and the microbiome. I mean, I think there's some data to support that makes positive changes for the microbiome. What that does for Parkinson's, no one knows at this point. So I don't know that we would say that you should do that. Certainly, I don't think anyone would advise going gluten-free or dairy-free for the sake of the Parkinson's. However, if you have lactose intolerance or you have celiac disease or gluten intolerance, trying out a gluten-free or a dairy-free diet for a month or 2 months is very doable and very safe. And so that's not unreasonable to try, but I don't think anyone would say for sure that is what you should be doing. I see here the mucuna, which this is kind of this works on dopamine receptors. It's kind of like a dopamine agonist. It's like an herbal that does this. There actually are not big studies for it. And so a lot of people use it. I actually don't know enough about it, to be honest. I do know that there are no big studies to support its use, which is why I didn't put it in there. I don't know potential side effects or risks of it, so I can't really say one way or the other enough about that. I do know, though, there is certainly not enough data in Parkinson's to suggest that this should be used.
Yeah, and just jumping in, I see Bernard has his hand raised. So if you want to ask your question, then we can get to Larry's question in the chat afterwards.
Great, thank you. And shout out to Dr. Weaver. I'm a patient of his. Dr. Weaver are great and very helpful to me. Could you just repeat actually the element you had just mentioned?
The mucuna?
Yes, how do you spell that?
It's this M-U-C-U-N-A. And pruriens is the second name. It's a really hard thing to pronounce, but mucuna pruriens, it's an herbal supplement. And again, I have to say, I don't know a whole lot about it. I do know that it works on the dopamine system. People use it in that sense, in a theoretical sense, in terms of like, sort of increasing the dopamine effect on the brain. I don't know if that interacts with medications or if that does anything that could potentially be harmful. So I would just have to say I don't know enough about it. But there are most people who treat Parkinson's have probably heard of this. I know it's a pretty common one for patients to have heard about and to bring up. I think though, because there's not enough evidence to support its use, most would tell you, not to do it.
Thank you. My actual question is, do you have any particular type of exercise or strength training or physical activity or that you would recommend more than others, other than what you've already shared with us?
No, not really. I think actually this is it's interesting when people look at weight loss, for instance. Everyone always wants to know what's the best diet, for weight loss. And there are a number of studies that actually show that it actually doesn't matter what diet you choose, as long as you stick to a diet. If you stick to a reasonable diet, the diet can't just be like junk food, right? But if you stick to a reasonable diet and you stay consistent with that diet for a long enough period of time, you will lose weight. And I think the same thing happens with resistance training or exercise. I'm not really sure that in the end, at least for now, since we don't have the data, I'm not really sure that it matters so much what you do as long as you're doing something. And I think just the sheer act of being active and being consistent with that activity is the way to go, because we just don't have enough to say like, this is definitely what you should do. I will tell you that a really good exercise plan is really looking at endurance, strengthening, balance, so kind of incorporating all of those elements into an exercise regimen is the key. So it shouldn't just be lifting weights. It should be a combination of some cardiovascular activity. It should be a combination of that with strength training and with balance training as well. So as long as you're kind of touching on all of those things, then I think that's the way to go.
Thank you so much.
Yeah.
I just want to quickly chime in about the Mucuna. As the nurse practitioner in the clinic, working with Parkinson's patients for 7+ years now, this has come up in conversation many times. I will say I've only had a very small handful of patients who reported some level of success with using it, and it's rather short-lived. So I think somebody with extremely mild early onset Parkinson's who's taking some of the supplementation, usually with levodopa as well, can find that, or they have reported that they're moving better. However, the titration is very difficult to really support. So we don't quite know how much Mucuna is equivalent to a dosage of levodopa. So it tends to be a trial and error by the person who's kind of self-experimenting a little bit. So Dr. Weaver, I would just say really, I don't have that much more information to add on, but exactly as you said, some people have explored over the years. There's not much study on it, and we don't simply know the titration, the quantity, right? How equivalent is it, and how much is actually bioavailable in the body, right? If you're taking the Mucuna as a supplementation.
Thank you so much for that, Natalie. And I think that brings up a good point, which is this is often how it works with supplements, is that we don't know optimal doses of things. We don't know how many times to take it. And people in general, most of these supplements can be safe, but not always. Sometimes we find out like vitamin E sounds like a totally safe thing to do. And you find out later when you look at the data and you really delve into it, that there's increased risk of certain kinds of cancers and things like that. So just blindly taking a supplement without really having enough data to back it up is not always the best thing. Now, if you're really looking for something and grasping at straws, again, some of these do have some safety data behind them. They've been studied to some degree, and that's where you would want to ask your doctor about them before using. And same thing, Frank says here, any interaction of supplements and levodopa. Again, I don't know of any offhand, and Natalie, feel free to chime in if you know of any. The ones that I mentioned, I don't think interact with levodopa in any meaningful way, but that is always something to think about. There are potentially interactions between supplements and other medications. And so that is something that, again, you would want to either look into, do your own research, and or more importantly, talk to your doctor about, because that does happen with certain supplements.
Yep, to add the only known interaction I'm aware of, if somebody requires iron supplementation, and usually for some other health related reason, the iron can bind with levodopa. So if a person's on both levodopa therapy and requiring, daily iron supplements, you have to get a little bit creative as to the timing and when you're taking, but it shouldn't be taken together at the same time.
Yeah. I just noticed one other comment in the chat I just wanted to bring up so it doesn't get skipped. It was about the blurred vision. And
oh, right. That I wrote back to Larry individually, because initially he did that individually. I don't know enough about exactly why people get blurred vision in Parkinson's. I suspect it's an autonomic issue that can occur where the eyes don't quite focus as much as they should. There are in some Parkinsonian disorders that not necessarily typical of regular straightforward Parkinson's, but you can have eye movement abnormalities as well. So I think there's a lot that could be going on there. Again, if there are visual symptoms, then you just bring it up with your doctor, and sometimes obviously at some point everyone should be seeing an ophthalmologist and getting good eye exams as well.
I did see a private chat. I apologize.
No worries.
Can I contact you through Allegra, or can I send you an email? You said you had some people I'm gonna talk to.
I would. Our group, this number here that you see on the screen, our movement disorder specialists are there, and that's exactly where I would start, and they would be able to guide you. Yep.
Okay. Thank you.
I'm also going to add an email address too, and this is for anybody who's interested in, further support group information, other community outreach that we'll be doing over the weeks and months ahead. So I'm putting it in the chat box. It's wcm450@med.cornell.edu.
Perfect. Thank you, Natalie. So that is in the chat. I see that there. So that's great. That's good to have another resource to reach out to.
Yeah, thank you. And if anyone also does want to reach out to me, I can connect you with anyone as well. And I think hopefully most of you have my email, but if not, I'll put it in the chat as well. Hopefully there's not too much in the chat, so get lost. And then I just see another question about Alzheimer's, I believe.
I'm not sure what the question is though, so.
Yeah, I'd like if you have a bit more clarification, Jean, that'd be great.
Okay, I would like to know if Alzheimer's and Parkinson are the same thing. Is there any connection between Alzheimer's and Parkinson's disease?
So that's a great question. There is a connection in the sense that both Parkinson's and Alzheimer's involve degeneration of parts of the brain, but they actually work on separate parts of the brain. There are cases where people with Parkinson's much later on in the disorder will develop enough degeneration that they do develop a dementia, okay? But it's separate from an Alzheimer's dementia. So some people can get a dementia related to Parkinson's. There's also something called Lewy body dementia. Lewy bodies are a type of protein that can be abnormal, that can cause issues with the cells in the brain, and that can be related to Parkinson's. So there's a number of reasons why you can get memory issues and get dementia that can be related to Parkinson's, but Alzheimer's is actually sort of a separate branch of dementia. It's also relatively common, so someone with Parkinson's may also develop Alzheimer's, but there's a lot of different mechanisms in terms of how that happens.